The topic of our self-massage today is
calming the upper back and neck. And for our class, you need a pair of small therapy balls. I don't know why I have two. I guess I couldn't figure out which color to roll on today. And also have a blanket. And will you have one block as well? This will be nice to have. And come to lie down on your back with your head on your blanket. And once you're resting here with your head on your blanket, open your arms out to the sides, slide your shoulder blades down your back, and do a light rock of your head right to left. Just a little rock here. Then rock your head back towards center and draw your shoulder blades down your back. Close your eyes and take a couple breaths right into your chest. And notice how deeply you're able to breathe today. Then reach out for your therapy balls, take them out of the tote, and place them one on each side of your upper back spine. So what you can do is trace your fingertips down the back of your neck, find that big lumpy vertebra C7, go one beneath it to T1, your first thoracic vertebra, one beneath that to T2, and put the therapy balls one on each side of T2. Keep your head resting on the blanket so you have a little extra lift. And if this is too intense, you could walk to the wall and pin the therapy balls against the wall instead. Reach your arms up toward the ceiling, soft elbows, palms in, and do a little rock and shoulder roll side to side. So you rock to one side and roll that shoulder and walk to the other side and roll that shoulder, just leaning side to side. And after some rocks side to side, gently drape your arms over yourself in a hug and continue this rock side to side. And by crossing your arms across your chest, it's going to spread your shoulder blades apart a bit more and lengthen the skin, fascia, and muscle, stretch it out between the shoulder blades, which is actually going to increase the intensity of the self-massage, because there's more stretch on stretch happening. Then reach your arms back up toward the ceiling and gently hug them around yourself with the other arm on top. Just a slight difference, and notice if that feels a little different in your massage. Then reach back behind your back and make sure the therapy balls are touching. So bring them really close together if they were a little wider. Then move your blanket and your body 1 inch backwards. Now this is going to bring the therapy balls a little lower down your back between your shoulder blades. Try to bring your hands to a prayer in front of your chest here, attempting to pull your elbows in toward one another, and move that prayer up and down, overhead and then down in front of your chin. So just sliding your arms front and back, and you'll feel little movements in the spine, the area that you're on here. Then reach your arms back. If possible, scoop up your head, interlace your hands behind your head. And with your hands interlaced behind your head, first take a big inhale. Then as you exhale, curl up, hinge up on the therapy balls. Inhale, lower down, and exhale, hinge up and down on the therapy balls so they make a little hinge. This is pretty incredible way to massage right into the nooks and crannies beside your intervertebral discs, and there are all these little bitty muscles holding the different spiky parts of your vertebrae and your spine together. It's so incredible how the therapy balls can go right into those nooks and crannies. Now, will you curl your head up and roll another inch backwards? And once you've done that, see if you can rest your head back down on your blanket and bring your arms into a cactus. And what I'd really love is if those therapy balls are between the bottom tips of your shoulder blades. So you can even reach around behind your back and find the inferior angle of your scapula. That's the bottom tip of your shoulder blade. And try and make the therapy balls right on the same line as that bottom tip of your shoulder blade. Cactus if possible, then flip your cactus. So you're turning your palms up and flipping your palms down. Now, you might not be able to move your arms very far. It might just be a little wave. So don't compare your movement to my movement here because I'm actually really mobile. Plus, I've been doing this self-massage for like 10 years. So I've really remodeled my tissue and how comfortable this is. Okay, then reach your arms overhead alongside your ears. And can you straighten your legs? And with your legs straight, rapidly point and flex your feet, and it'll cause your body to rock up and down, and those therapy balls to rock into the mid spine right here, just more passively, like just like that. Then be still, inhale, and exhale. Place your feet on the floor, lean over and try not to sit up as you take the therapy balls out from underneath you. So you just let your spine settle right back down. Hold one in each hand, close your eyes. Breathe and notice if your breath feels a little different from when we started out. Then reach out for one of your blocks. And this is the move for this next part. We're taking the therapy balls above your shoulder blades. So if you reach over and find the superior edge, the spine of your scapula, this top edge, it's called a spine because it's shaped like an S. It's really cool. It's a wave. But if you go just above that, so the top of the shoulder, right on top here where a backpack strap would go over, we're putting the therapy balls one on each side on top, and they're poking out the top. Then what we do is we take the block, lift your hips, put the block underneath so that your body weight tumbles down into the therapy balls. If this is too intense, you can do it, whoopsie daisy, you can do it without the blocks or the block and just find a gentler angle. If possible, use that block to tumble down in here. Now, if you have a ton of mobility, I really don't want you to crank your neck, but if you have a ton of mobility and you've done this a lot, you could put the block on the highest setting. That's just going to really angle down. Make sure you are not overstretching your neck. You feel safe. You feel okay here. Then reach your arms open to the sides and rock right to left. So it's basically like a slow shoulder shimmy side to side. I just saw myself in the video. It looks ridiculous. Then a little sway of the arms up and down with the rock. Oh my goodness. And some of you might find that there is like, it's very naughty in here. Like, it is on the naughty list. Your supraspinatus, which is one of your rotator cuff muscles up here. Okay, so after that, you might explore reaching your arms overhead. I just landed my hands on my blanket overhead, which was a very happy accident, and rock a little forward and back with the arms overhead. Then come back to stillness, bring your arms back down to your sides, Lift your hips, take the block out, then remove the therapy balls from under your shoulders. Bring the blanket back under your head. Open your arms to the sides, and just like in the beginning of class, do a light rock of your head right and left. Then close your eyes and take several breaths. Notice if it's just easier and more natural to breathe really deeply. All right. Stay here and breathe until you feel complete. And in the meantime, I can't wait to roll with you again soon.
Great job. Now it's time to seal in your self massage practice with my all in 20 full body awakening. In just 20 minutes, you'll activate every major muscle group, you'll mobilize all the major joints in your body, and it's going to leave you feeling energized and centered. Get it totally free at fitbodlife.com.